All right, so to start with, I would like to ask everyone to share in the chat what field you are planning to apply to and when you're planning to apply, if you're planning to apply right now or sometime in the future. So please feel free to put your answer in the chat. You can also unmute yourself and speak if you'd like. Okay, so dentistry this summer, great. Public health 2026, okay. MD programs this cycle, this upcoming cycle. You get a like, so I'm assuming that that person is probably going to do the same thing. Okay, anybody else want to share? Is anyone applying to PA programs? Or nursing programs or anything like that? Okay. So it looks like we have at least dentistry, public health, and MD programs. That's good to know. Thank you. I will touch on the other, some other health fields as well in terms of what they expect for experiences, since I know that people will be able to see this online afterwards. I wanted to also mention that if you have any questions throughout this presentation, please feel free to put them in the chat and or raise your virtual hand and unmute yourself and ask a question. I will also pause periodically to see if anybody has any questions as well. So, experiences are important for your application, similar to the personal statement that I talked about last week, because they give context to who you are, what you value, and what you would bring to their program, and also to patients in the future. So, kind of along those lines, who you are and what you care about, so they can see through your experiences if you care about community service and specifically working with like children or elderly people or students or people in your community. They'll be able to see those things through your experiences. And then they will also see through the variety of experiences that you have and the length of the experiences that you have, what your commitment is to what you care about and what you've learned through those experiences. And then it also helps to show them what's driving you to go into this healthcare field and potentially not another one, because they will often ask that at some point in your application. But you can show, for example, if you're going into dentistry, that you've been, that you've shadowed dentists, that you've had experiences volunteering with oral health or disease prevention or things like that. And that'll show that you understand what the field is like and also that you are continuing to be interested in it. So I jumped ahead of myself there. That shows that you understand what the field is like. So through things like shadowing or working alongside dentists or other healthcare professionals, you would be able to know why specifically you want to be a dentist or an optometrist or a nurse or a PA or an MD, or want to go into public health. And then the experiences will also show the value that you bring to that field. So they will show the things that you've learned through those experiences, the growth that you've experienced, the impact that you've had on people, and the impact that they've had on you as well. And just showing the progression of your ability to kind of based on what I was talking about last week, what you want to do for people as a healthcare provider in the future. They'll be able to see how you've worked towards that goal so far, even beyond what you wrote in the personal statement. So if you say, for example, that you want to be a PA because you want to help educate your patients and spend more time with them, then maybe in your experiences, you would obviously want to show everything that you've done that would go towards that goal, but they could see that you spent a couple of years tutoring, that you spent a couple of years with health education promotions, things like that. So, and then they will also show your skills and attributes. So the things that they're looking for within a particular field. For example, within dentistry, they're looking for manual dexterity. And a lot of people's experiences, even outside of healthcare, like if they crochet or if they do watercolor painting or if they Like pretty much anything that shows that manual dexterity is going to be valuable to them. Okay, and so your experiences can include a lot of different things. These are just a couple of example pictures on the side. They could be clinical work, or they could be something that's not even related to healthcare. But generally, they're going to be things that you've done since you graduated from high school. Could also be experiences that started in high school, but then continued into college. But if it's something that started and ended in high school, then you wouldn't want to include that. It would just be something that continues or that started afterwards. Now, there's one exception to that. Nobody mentioned here that they were applying to vet schools, but often for vet schools, they are okay with experiences from high school, especially ones that specifically relate to vet. And usually, or for many of the application systems, you can talk about past experiences and current experiences as well as planned. So it could be something that you are doing right now, or right now meaning when you apply, when you press that submit button, and that you will continue up until the time when you start in that program. Or some application systems, such as the MD system called AMCAS, will allow you to add activities that you haven't started yet, but that you plan to do. And that's actually a new development, which is kind of cool for that program or for those programs. You can also, for some application systems, you can add multiple date ranges. They'll actually have a spot for each one. Or if they don't have that, you can include the date ranges in the experience description itself. So if you had a job that you did every time you went home for the summer for a couple of months, then you could put that into the experience description section. And then, as I mentioned, these can be activities related to your future field, healthcare in general, or activities that are completely unrelated to healthcare, but would still be valuable to admissions committees. Okay, so the experience categories that you can choose from when you're entering your experiences in any of these application systems can be quite varied, as you can see here. So AMCAS, as I mentioned before, is the MD application. You have all of these different categories to choose from. So for example, if you had an experience where you were the treasurer of the salsa dancing club on campus or something, you definitely want to include that because it shows leadership and it shows your interests. So that would likely fall under extracurricular activities. And so there's a lot of different categories here. So you'd want to see, which one would most closely represent what you did in that experience. Oh, and thank you for the latest person in the chat saying veterinarian this upcoming cycle. So thank you for mentioning that. And then if you notice, of course, AACOMAS over here, which is the DO application, the osteopathic medicine application, there's only 4. So you would have to sort between all the ones that you did for AMCAS if you're applying for both. A lot of people do apply for MD and DO schools at the same time. You would have to decide which of those 4 your experiences would fall under. So VEMCAS is for vet med. So that would be the difference between animal experience with a veterinarian involved, like watching over you or supervised by one, versus veterinary experience with one or without one, is basically what I'm trying to say. And then we have CASPA, which is for PA schools there at the bottom. Obviously, this is not an exhaustive list, so there are other application systems with other categories, but this kind of gives an overview of the different things that you would be categorizing your experiences as. And if you have any questions with how to categorize your experiences, you can, of course, come to see us and we can help you with that. Okay. And then some sample experiences to include. Of course, this is not an exhaustive list, but it could be any of these things. Could be clinical experience, and there's a lot of different things under there. Generally, clinical experience is going to include something where you were in close contact with a patient. So you may not have been hands-on, but you were at least like handing them a glass of water or giving them a blanket or sitting down next to them and talking to them. And so again, there's a lot of different ways that you can get that clinical experience. But any of these experiences, we would definitely encourage you to include in your application. Same with research. So there can be different types of research. Of course, there's lab, wet lab. There's non-science research. So if you did sociological research, psychological research, anything that you've done with, for example, the UC Davis Medical Center at the Mind Institute or MRAP or research would all count for that research. And then volunteer is pretty much anything that you've done that obviously you wouldn't get paid for, that would also speak to, your value for community service, providing service to people who may be less fortunate, providing service to people who are in need, for example, as the crisis hotline worker. And then extracurricular is generally anything outside of school and work. So that could be anything like athletics, student organizations or clubs, fraternities and sororities. I do have a lot of people who ask, should I include that I was in a fraternity or sorority? And you definitely should, because there's a lot of advantages and benefits to talking about your experience there. And then, of course, any hobbies. So if you play guitar, or if you play soccer, or if you, like I mentioned, manual dexterity, if you like to paint, if you like to bake, anything like that can be definitely something you could include. And then paid experiences, these could be anything. So it could be something related to healthcare, it could be something outside of healthcare. If you have to work, you have to work. And any kind of experience like that is going to be helpful for your application, because like I talk a lot about if you need to work at Target or if you need to work at McCooney while you're a student. All of that is customer service, which is going to be very valuable when you're working with patients. And can often lead to stories where you could, like, that eventually they'll ask you in interviews or in secondaries and supplementals, tell us about a time when you had a conflict with someone, or what do you do in stressful situations? And if you have those kinds of experiences, that can be very helpful. Okay, so in terms of length for your experience descriptions, you get, for AMCAS again, which is the MD application, you get 15 total experiences, and each of those descriptions is 700 characters each. And if you notice down at the bottom, I mentioned that all character counts, everything here includes spaces. And then you get to choose 3 most meaningful experiences from those 15. And you actually click on a little checkbox that will open a new box, another box that will be 1,325 additional characters. So I like to make it very clear that those are 2 separate boxes, because sometimes people get to the point of writing these and they don't realize that. And so they need to separate it into the 700 characters and the 1,325. And then pretty much every other application system, I have yet to come across one that isn't like this, but they are all unlimited experiences, and you get 600 characters for each one. Some of them you may be able to choose something similar to the most meaningful. You might be able to put stars next to them, but you wouldn't get a chance to write more. But there are ways of, I mean, as you noticed, you get fewer characters for those unlimited experiences, but you could separate an experience. For example, if you were in, go with the salsa club again, first you were a member, then you became the treasurer, and then you became the president. Those could be 3 different experiences in the unlimited experience applications. And then you have 600, 600, and 600 to talk about each of those. So there are strategies in order to maximize the amount of space you get. Are there any questions so far? Okay, I will keep going. So with the experience descriptions, you would go into your application system for that intended healthcare field, and you would copy paste or type directly in there. There's other information that we'll talk about in a few minutes that you would also include, but then there is a box where you would put the actual experience description. The way that you write these descriptions, like what you include, may change based on the expectations of the field you're applying to. So an example of that, I know no one mentioned specifically that they were applying to PA programs, but if anyone is, or anyone thinking about it, those descriptions are going to be more resume-ish. So they don't need to be necessarily complete sentences. It's mainly like, I did this, I did this, I did this. So it's going to be relatively dry in that sense. Um, but for most of the other fields, like we generally recommend having full sentences so that you can also have a reflection on what you learned and what you did in that experience. So that's the main difference that I know of that would really go into like how you write the description. Some of the other things that you can include, you can assume generally that the admissions committees know what a shadow does or what they see, or that they know what a scribe does or what vet tech does on a daily basis. What they don't know is like the specific things that you learned from that experience, the things that you maybe struggled with at first and then learned how to do. So it's those other kind of details that you can include for all the other healthcare field applications. And then I think I mentioned this already. So depending on the field, you may have a chance to choose several experiences to highlight with or without an additional explanation. And I feel like this is one of the most important parts. So there are people online who, or students of ours that come back to us and say, oh, I read so-and-so online, or I saw a video where they recommended putting a story into my 700 character portion, like the basic portion, or the 600 character portion for all the other application systems. And they recommend putting a story in there to describe what I did. And the tricky part about that is that you don't really have enough space in 700 characters to be able to, or 600 characters, to be able to talk about a specific story. And also through that story, show what you did in this experience. So we heard directly from admissions committee representatives in a forum that we had that this is what they would prefer to see. So instead of having that story in the basic description, you can include, generally at least, one sentence to describe the experience or organization if it isn't clear from the name. If it is, then you don't necessarily need that. 1 to 2 sentences to describe your roles and responsibilities. So what did you do? And then 1 or 2 sentences to show your accomplishments, skills you gained, lessons you learned, impact the position had on you. So it's kind of the reflection part at the end. Now going back again to, or not again, but going back to this part about most meaningful experiences, for those you could put a story. So you could talk about a specific story about working with a patient or working with a 2T or a client or somebody that you feel like would really highlight the things that you want the admissions committees to know. But again, for the 700 character or 600 character portions, we recommend sticking more to what I have here. This is more or less word for word what they told us that they would prefer. Any questions on this part? Okay. So I already touched a little bit on the most meaningful description. Again, this is for the MD applications. You get 3 of the total 15 to choose as most meaningful. So when you're writing those, you would want to think about the transformative nature of the experience, the impact you made, and the personal growth you experienced as a result of your participation. And again, you could tell a story here if you wanted to. You don't have to, but you can. Okay, so this might sound like a lot, a lot to go over and a lot to do. But basically how you can start, you can write down, make a list of all the things that you've done since you graduated from high school or that you continue to do after high school. That's fine too. And then based on those, if you are applying to a program or an application system that allows you to have unlimited experiences, you could include all of them. I would say you don't need to include 50 experiences though, so maybe pick and choose if you have quite a few. We can help you figure out which ones you want to include. And then of course for the MD applications where you need to choose 15, we can also help you to choose those too. But based on the experiences you decide to include, you can start writing based on the following. So how many hours did you spend over how much time? What were your responsibilities? What kind of impact did it have on you? What kind of impact did you have on others? Which qualities can you highlight about yourself through this description? Which core competencies are relevant here, which I'll talk about in just a moment. and what did you learn and how did you grow? It doesn't mean you have to talk about all these things in each one. It is a lot, but this can help you to try to figure out what you want to talk about and how you want to talk about it. And I know somebody had a question. So do these applications also ask you to submit a resume or CV, or does this section serve as a replacement of that? That is a very good question because a lot of them will, MD schools, I don't believe ask for a resume or CV. I don't think DO schools do either. I've never heard of that, but other programs may request a resume or CV, such as nursing or public health, for example. And yes, this would not be a replacement of that. This would be in addition to that. So you'd be doing the resume or CV and doing the experience descriptions. It does feel like a lot, but hopefully you can either copy paste depending on what you put in the resume, or you can generally use the same information and just make it into full sentences. Someone asked, sorry, might have missed this, but for the MD application, will we be writing this 700 word responses for all 15? So it's 700 character responses, so definitely shorter than 700 words. And yes, that would be for all 15. From those 15, then you can, like I said, there's a little checkbox next to each one. Is this the most meaningful? You choose 3 of them, and then it gives you a separate box where you add more information. And I should say too, not everyone has 15 experiences, and that is totally fine. You don't have to have 15. You could have 9 or 10 and be fine and still get into med school. And oh yeah, sorry about the confusion with the 3 most meaningful versus the 15 total. Yeah, so it's 15 total, and of those 15, which 3 are the most meaningful to you? Okay. All right, so these are the core competencies that I've been referencing a little bit throughout. I would say that, and actually this was in one of our other versions of a PowerPoint, we also had manual dexterity. So in order to be more inclusive of all the different health professions and what they value, this is a good place to start at least, because I think that even though this is meant for MD applicants, I think this is important for all health professions to have and develop these types of competencies. So that could be anything from cultural awareness and humility to service orientation, reliability, dependability, critical thinking, written communication. So a lot of these things are going to shine throughout your application. I mentioned this before. Include it in your personal statement, in your descriptions of your experiences, and also in your secondaries and in the letters of recommendation that are written for you. So they will shine through in a lot of different ways. So don't feel like you have to talk about all of them even throughout your application or in any particular section. But where you feel like they would be best highlighted, you can definitely include things, but without necessarily saying, I am culturally aware or I am resilient and adaptable. Like you can show it in different ways, not necessarily always through a story, but through a general description of, like, at first I struggled in this position to learn because I'm making this up, but because there was no one there to train me and I had to train myself. But I finally figured it out by asking for help and reading the manuals and working with patients and just jumping right in. And so indirectly, we've said that this person is resilient and adaptable, that they have teamwork and collaboration by asking for help. They have oral communication skills. So, through those experiences, you'll be able to show these things. And then, so this is the information that you'll include, and there's actually a picture in the next, maybe I will actually show this first. So this is what it looks like in an application. This would be exactly what the admissions committee would see. So it'll show experience type. So this person chose this. Experience name, wherever they worked, contact name and title obviously is not here. But you would want to include these. So definitely keep track of that. If you haven't already, maybe start trying to gather that information for your experiences, because you want to include that for all of them. And organization name, location. This person said it's not a most meaningful experience. And then they would have the dates that they worked and the hours. I believe those are calculated automatically based on the information you put in here. And then, so going back, here. This is more of just a list of things that you need to gather. So that would be experience type, name, contact name and title, contact email or phone. You don't normally have to do both necessarily. Organization name, location, experience description, dates, and total hours. So that's all of the information that they will be asking for. And I'll leave this up for a second so you can take a look through this description. But basically you can see that at first they're giving a general idea of what they did. So they led discussions, they served as a peer mentor for students, and they mentioned that they were recognized as PLF, I always forget, Peer Learning Facility of the month for outstanding student evaluations. They were promoted, and then they talk about things that they learned to do based on this experience. So it's not that you always have to have been promoted or anything like that. Like they could have gone into, some kind of reflection on what it meant to them to be a peer mentor for students from these other backgrounds. Like maybe they came from a similar background and they always knew that they wanted to give back and help other people in similar situations. So that would be, something that they could include here. Any questions based on this description? Or anything that I've talked about recently? Okay. So when you're writing, I would say this for any of the writing that you're doing for your applications, try not to worry too much about the character count when you're drafting, especially for these, they're very short. You can always come back later and cut back, but often when people have that character count in their mind at the same time that they're trying to generate content, it becomes confusing for the reader. Often when I'm reading, I can tell that someone was worrying about that at the same time because the story maybe got cut off right in the middle. And I don't understand the connection between that and the next part that came. So just write it all down and then we can go back through with you and figure out how much you want to keep. And then you may have already written content that would fit in this when you're drafting your personal statement or any other writing that you've done. Or if you've kept a journal of your experiences, then maybe you already have something in there that you could copy. And then I did mention this already. So if you had multiple roles within an experience, you might be able to use 2 separate experience entries to get more writing space, or even more than 2. And then if you had more than one similar experience, like shadowing, and you feel like, oh, I don't have enough to talk about that would take up, full character count in like 3 different shadowing experiences, you can combine them into one if you want to. Like you could do 2 in 1 or 3 in 1. And then you could just give a brief description like shadow Dr. So-and-so, so whatever specialist they were for these number of hours or dates, or shadowed this dentist during this time. So you can put that into the experience description. And then if you do plan to copy and paste into the application, we recommend using something like Microsoft Notepad or Mac Text Edit to be able to just write it in plain text. Because if you put any kind of special characters or anything other than just basic text, it's not going to show up in the actual box that you would submit it in. Okay, so some common questions that you might be thinking right now. I already mentioned the first one. You don't have to have 15 experiences for AMCAS. It's just however many you have. And how can I fit all the information I need to in 600 to 700 characters? So that can be difficult. But again, we can help you to figure out what you want to put where. Even in your AMCAS or MD application, you can have more than one entry for an experience. So sometimes when people work maybe in a student-run clinic in multiple roles, they might have enough information for each of those roles descriptions to be able to separate it into 2 and also not go over 15 experiences. So that's also an option too. And then I often get this question, should I include an experience in the experiences section if I'm also going to talk about it in my personal statement? Does anybody know the answer to that? put it in the chat. I have a yes question mark. Yes. Does anybody else know? Okay, well, I got two responses, but they're both correct. So yes, you would want to put all of your experiences in the experience section that you want the admissions committees to see. And you'll also talk about those potentially in your personal statement. But all the experiences will be in the experience section. So in the personal statement, like I talked about last week, it doesn't need to be a list of things. Like it's not a resume. It's an in-depth dive into particular experiences, particular stories within those experiences that are going to show who you are and what you bring to medicine. So the information is going to be different. Like the experience section will be more zoomed out, like on a daily basis, I did these things, I learned this overall, I enjoyed these things about this position. But in the personal statement, it'll be more like, I worked here working with elderly people, making sure that they had the opportunity to be social with someone or be social with each other. One day, so one of our residents didn't want to participate in the talks, so we are in the discussion, and I needed to go talk to them individually, and then you could tell that individual story. So that would be different information from what you put into the experience section. And then I already talked about writing stories in the experience descriptions, saving that for the most meaningful for MD. For any of the other ones, for the 600 or 700 character sections, we would recommend not writing stories. Just keep the stories for the personal statement and for potentially for your secondaries. When should I start writing my experience descriptions? You can start anytime. Often people will, like I mentioned before, when they're drafting for their personal statement, they might decide, oh, I'm not going to use this for my personal statement anymore because it's too broad, and I'm going to use it for my experience description instead. So you might end up doing both at the same time in some ways. But we definitely recommend starting those early as well, because even though they're short, people often will come to us maybe in May or June saying, I thought these would be easy because they're so short. And unfortunately, they're not, because also because they're so short. So definitely try to start as soon as you can. And also keep in mind that you may be working on them alongside basically when you're writing your other things. And then I did mention this before, but do you need to include a contact for all of your experiences? Yes. And you need to also click the box that says that the admissions committees can contact them. If you say that they cannot contact them, that is a red flag, because they might wonder, well, why can't we contact them? What happened? And it's highly, highly unlikely that they will contact them, because they have so many applications and it's a lot of work to try to contact anybody mentioned in the experiences. So definitely say that they can contact them. If it's an experience that's over, like something that maybe you're a part of a club in your freshman and sophomore years, and the president is not the same president anymore, or the leadership is different, you could still put the current leadership, and hopefully they would have some kind of record or be able to speak to the fact that you were there. Although again, it's very unlikely that admissions committees would actually contact them. If you are including something like your own hobbies, like if you paint or if you play the violin or something, you can put yourself as a contact for those. But for anything where you'd have a supervisor or someone that can vouch for you, you'd want to put their information instead. And then in there, let's see, my next question here is, do I need to relate all of my experiences back to my future healthcare field? And in that, I meant the actual experience description. So sometimes people feel like, I'm talking about playing piano for 10 years, and this is going to help me be a better doctor because of XYZ. And you don't have to do that. If it's something that's directly related to healthcare or being a doctor, then yes, you can, but you don't have to do that for all of them, and certainly not for the ones that aren't even related to healthcare. Because that essentially takes the space away from you to be able to talk about what you enjoyed about it, what you learned about yourself or other people. And they can make the connection, like they're able to see, like, if you have this dedication to playing piano for so many years, you have that dedication for other things. And then a common question too is, should I write in complete sentences or in bullet points? I mentioned before that generally we recommend complete sentences because then you can have more of that reflection. It's hard to have reflection when you're doing bullet points. But whichever one you choose, you want to be consistent throughout. So often, again, like I was saying before, sometimes or often people applying to PA school will do bullet points because it can be more resume-like. But if they do bullet points in one, then they need to do that in all of them, or complete sentences in one, then they need to do complete sentences in all of them. And I actually included this part in at the very beginning, but just to review, depending on whatever field you're applying to, you may be able to include experiences you plan to do in the future but haven't started yet, but just double check with that application system. And then, do I need to enter my experiences in any particular order? Does anyone know? Put it in the chat. Do you need to enter them in any particular order? Most important comes first. No question mark. I like the question marks. But thank you for fielding a guess. No, you actually don't need to put them in any particular order because the admissions committees will be able to sort them and arrange them in whatever order they want. So no, it doesn't matter what, like if you put in an experience from senior year first and then experience from junior year second, that's not going to make any difference in how they view your application. Okay, so I have a couple sample experience descriptions that I would like you all to just read through. I'll give you a couple minutes to read through this one, and there's one more after this. So just take a look through what it says and think about whether you feel like it is effective. Okay. So hopefully everybody's had a chance to look through it. Does anyone want to put in the chat how they feel about it? Do you feel like it's effective? Do you feel like it gives a good idea of what this person did? Do you feel like it's not effective? And you can give reasons too, of course. Okay, I have a comment saying yes, because it details what they did and why it means so much to them. I think it showed good qualities, but some sentences seem longer than they need to be. Okay, any other feedback? Okay, so another quick question, or I guess let's go through a little bit some of the details here. So they did say spent 2 years working as a health educator for the Student Run Clinic Imani. one thing I didn't mention before is you don't necessarily have to have all that information in the first sentence, because if you notice back here, all of that information is already included. So they already know that it was 2 years. They already know what the position was. They already know who they worked for. So they could just skip through that and say, um, working at Imani, and then jump into the next sentence even. Um, so that can be one way to cut back on characters as well. I almost forgot to mention that. So we do have this basic information. This sentence has a bit of a problem though. We made a huge impact on the community by offering these medical services. Do they know for sure that they made a huge impact on the community? I mean, we could assume, but not necessarily. Maybe this is something that is just kind of scraping a little bit at the problem, but not really doing enough. And maybe a lot of the people who came there wouldn't say that they felt like there was a huge impact on their health. So we don't know that. So you don't want to assume how you affected someone or how you affected a community. Um, Rather, you'd want to focus on the things that you did do, that you know that you did. Um, like this would be, we had to turn people away. That's something that this person saw directly. Um, and tried to hard to serve as many people as possible, offering information. So that's good. Those are things that they did. Um, and they did this hands-on care, such as taking blood pressure, glucose checks. Um, and this is helpful too. Like they were able to witness what doctors, PAs, and medical students were doing. And that can help people in figuring out like obviously this person wants to apply to med school because they have 691 characters, which they would need for the 700 character count. So we could see a little bit that they would understand what doctors do based on this experience. Um, and then let's see, learned a lot from this experience, solidified my desire to become a physician who wants to serve this population. But we don't know what exactly they learned. They could be a lot more specific than that. Like, what exactly did they learn? Did they learn how to connect with people from different backgrounds? Did they learn some of the social determinants of health that are keeping people down and keeping them from being able to access this kind of care? Did they learn how to work well with the healthcare team? Like they say they worked alongside these people, but like what were their teamwork skills? Like how did they communicate with them? How did they know, you know, um, like the role that they played in comparison to what the other people were doing? And then also solidified my desire to become a physician who wants to serve this population. Why do they want to serve this population? Like we don't know exactly what's drawing them back, except that they felt like they made a big impact and they learned some of these skills. So some of this is on the surface, okay. It's not very much in depth, though. It wouldn't tell the reader very much about this person or what they learned from this experience. And it may even signal to the reader that this person doesn't quite understand the depth of what they were doing or the people that they were working with, like the depth of the situations. So with that in mind, please take a quick look at this one. And then if you want to just put in the chat right away, whenever you're done, say how you feel about this one. Do you feel like this one is effective? Is it more effective, less effective than the previous one? Um, and then some ways that you might, some reasons why. Okay. Does anyone have any thoughts on this one? Do you feel like it's effective? Not effective? Yeah, though truthful and passionate feels kind of negative. Yeah. Yeah, they could change some of the tone maybe if they wanted to be a little bit more positive, but it does feel more genuine, at least to me, like um, recognizing that they can't fix everything, but that they want to be a part of it. You can point out negative things in healthcare. You just have to be careful. You don't want to make it sound like, all doctors are terrible or the whole healthcare system is terrible. Um, but you can talk about your own personal experience with it and what you've taken away and what you've seen. So if we look at the first sentence, as I mentioned in the last one, this person doesn't say, well, I guess they did say that they were medical Spanish interpreter, but they didn't say, where they worked until down here because they've already mentioned it up above in the experience description details. Um, so you don't have to repeat those things, but they did give a general overview of what they did in this experience. But then they talk about some things that they took away from it, some things that they realized about the people they were helping or the system that Imani exists in. Um, and then at the end, it shows the takeaway. Like, what are they taking away from this experience? They want to change the system so that, people's health care concerns will be met by doctors and not just college undergraduates. But they could even get more specific about some things in here, some things that they saw, or some things that they took away. But I think this one, admissions committees would probably see this more as like this person, they tried their best to do what they could for this, for the patients that they worked with, but they realized the limitations that they had and they want to do more, which is important, of course. Okay, and in the interest of time, I know we have less than a minute left. Does anyone have any final questions? I will stick around a few minutes afterwards if anyone has any questions they want to ask directly. But does anyone have any other questions before we finish up? Okay. Again, I will stick around for a couple of minutes if anyone has any other questions, but thank you all for coming today and thank you for participating. And I hope that you have a good rest of your day and that we see you sometime soon at HPA.